Hi, my name is Dr. Zachary, and I'm the developer of the Handmaster Plus hand exercise system. And I've been getting a lot of questions over the last year about carpal tunnel syndrome and should I have surgery? Is that the best solution? And very adamantly, I will say that if your case is like most carpal tunnel syndrome cases, it is due to a repetitive stress, injury, cumulative trauma disorder type of situation, where there's been regular kind of trauma or stress or repetitive motion to the joint, especially of the hand. And to me, it's one of the biggest crimes that this is regularly scheduled and diagnosed for, and set up for surgery. When you can go to a practitioner that is skilled in working with carpal tunnel syndrome situations, this is a relatively simple case for them. It's again very difficult if you're not trained in it, but I recommend that you visit the website for the active release technique practitioners, and that's at activerelease.com, and they will be able to analyze all the tissues that complement the carpal tunnel and support the carpal tunnel, and they will usually be able to help you with the symptoms of that problem within 1 to as much as 6 or 7 visits, and they can handle that. It's a common thing that they see. So that's the first thing to do, is to be diagnosed and to be treated, and they will break down the adhesions that happen in the muscles that contribute to the stability of the carpal tunnel. Again, it's a relatively common thing for them to see. You have to go to the right practitioners. Surgery in a cumulative trauma disorder situation is rarely, very rarely needed. After the work on the soft tissue, that's where we recommend doing the re-strengthening exercises, and always a active release technique practitioner will recommend stretching and strengthening exercises. And the product we use for that is the Handmaster Plus. A very simple exercise for carpal tunnel people to follow through with. Before we developed Handmaster Plus, we would give carpal tunnel rehab patients 4 or 5 exercises, and they would rarely remember them and therefore rarely do them. So we never really did get the area re-strengthened and rebalanced, so that carpal tunnel is unlikely to come back. Now what we do is we just have the patient keep the wrist straight. They slip these cords onto their fingers and thumb, and they very simply are going to squeeze the ball for a count of 1 second, and then open and spread for a count of 1 second. Squeeze, open and spread. And everybody can remember to close and open and spread their hands. So it's very, very easy to use. There's no excuse for not being able to completely re-strengthen and retrain the area to the point where it is stable. Whatever duties you're doing, or sports or music you're doing, you can get back to maximum performance. It's very simple, and all the instructions are inside. To get a hold of the Handmaster Plus, you can just visit our website at www.doczac.com and purchase online, or you can purchase through one of our distributors that are also posted online. But again, carpal tunnel syndrome, if it is due to a cumulative stress disorder, cumulative trauma disorder, it should rarely, if ever, go to surgery. Go to an active release technique practitioner. They can analyze it, break it down properly to restabilize the joint, and then we want to strengthen and balance the muscles around that joint and reestablish blood flow using Handmaster Plus. I hope that's helpful to you. Thank you for watching.